thank you everyone for joining. I'm very excited to be here to talk with you about self-care. And I wanted to start by talking about some of the research that we've conducted at Yale on self-care behaviors. So to give you a bit more background, I'm a clinical psychologist and I teach in the School of Public Health at Yale. And for many years, I studied clinical treatments, meaning that I worked on figuring out the best treatments for people experiencing a variety of mental health issues. And then over time, I shifted that focus to begin looking at ways to prevent the onset or worsening of mental health problems. And so for the past several years, I've been studying the application of public health prevention principles to mental health, which is really just a technical way of saying that I started studying self-care as a technique to improve physical and mental health. And so to start, I wanted to tell you a little bit about the public health approach to problems and how this fits in with mental health specifically. So at its essence, the field of public health focuses on optimizing health, but it does so in a slightly different manner from the medical or the clinical model, in that its primary focus is on the prevention of disease and on early intervention. And so what this means is that if we were to consider health and wellness on a continuum, what we typically think of with respect to intervention is here, the point of illness or pain or injury, some clinically significant threshold at which we would provide treatment. But the focus of the field of mental health is to intervene a lot earlier in the process, either at the very earliest stages of developing a disease, or even as a blanket approach applied to everyone who might be vulnerable to a specific problem. So for example, we might recommend giving people a vaccine to prevent the onset of a communicable disease, so that even in the case of eventual exposure, a person's risk of becoming sick would be reduced. So when we consider public health, the public health approach to physical ailments, there are a lot of things that we know we can do to try to prevent disease onset. And so we have education campaigns and health classes, starting even in early elementary school, where we learn about appropriate nutrition, for example, or good hygiene and hand washing, and other things that we can do to optimize our resistance to illness. And when it comes to the coronavirus pandemic, for example, there are many public service announcements and public health messages about how to best prevent the likelihood of transmission. But when it comes to protecting our other aspects of our physical health, including our mental health during this time, our information is somewhat lacking. And in fact, even in normal times, we get very little information as to how to protect our emotional and mental well-being. So in public health, one of the things that we try to figure out how to do to prevent a disease from occurring is to identify the risk factors. And so if we're able to identify and mitigate these risk factors, we can then reduce the likelihood of a disease developing. So then when we're thinking about mental health, we've identified a variety of risk factors that contribute to mental and emotional difficulties. Risk factors are things like stress, financial difficulties, sleep deprivation, fatigue, poor nutrition, lack of social support, alcohol or other substance abuse, and also certain styles of thinking, such as pessimistic attitudes and self-criticism. And these are all things that can put anyone at risk for developing mental problems. Also note that some of these risk behaviors are almost normative right now. It feels like everyone is experiencing some or all of these risk factors during the novel coronavirus epidemic. So from a prevention standpoint, this means that each of us needs to take very active steps to protect our emotional and mental well-being. And some of these involve taking care of our physical health. So trying to get enough sleep and trying to eat well, try to be physically active and take active measures to manage our stress. All of these contribute to our emotional well-being in significant ways. And these are all things that we can do or should try to do for ourselves to try to build our resistance. Now, here's the point of the talk today. It's really easy for us to say things like engage in self-care. In fact, it's a lot easier said than done. And we very seldom get information about how to modify these health behaviors. And this is an important consideration, especially because we know that changing behavior of any kind, and especially health behaviors, is very difficult. So my goal today is to equip you with very small strategies, sort of a toolkit for how to make small modifications in your health behaviors to help you build up this resistance. And the first thing that I recommend is to start with one small specific area or behavioral goal that you would like to modify. A lot of times we don't meet our goals in behavior change programs because we try to take on too much too fast. We try to go from 0 to 60 and really try to say, okay, tomorrow is going to be the day where, almost like a New Year's resolution type of approach. And we know that these approaches are ineffective in the long term. So instead, my recommendation to you would be to pick one small behavior change goal at a time and employ strategies to try to meet that goal. So in setting this goal, I would like to recommend the SMART goals acronym or strategy, meaning that the goal should be very specific, something that you can evaluate very easily in terms of whether or not you've met the goal. It should be something that is within reach, something that you could realistically do, and also something that it matters, something that is individually important, relevant to your own priorities or goals or individual circumstances. And finally, it should be tied to a very specific time frame, potentially even scheduled or built into a daily routine. And I'll tell you a little bit more about that. So here are two examples, which are both great goals, but they vary in respect to how well they align with the SMART goal guidelines. So the first one, be more active, is definitely commendable. But the difficulty here is that the goal is not very specific. And so it would be really tough for someone with that goal to evaluate whether or not they had achieved it. Similarly, is it measurable? Maybe. If somebody has, for example, a smartwatch that tracks their physical activity, then they might be able to get a record of their activity level. But without a device like that, it would probably be really difficult to determine whether or not they had met that goal. In terms of whether it's attainable, again, it's hard to tell because we don't really have a clear idea of what the individual aims to do. Is it relevant? Sure. Is it time-based? Again, doesn't really seem to be. It's not very specific with respect to how frequently or in what way someone might want to be more active. But this second goal of stretching for 10 minutes every day, that does meet all of the SMART criteria. It is time-based, it's very specific, it's likely attainable, and it's certainly able to be measured, and we can reflect back over the course of the day and say whether or not, yes, I met that 10-minute goal. And finally, engaging in this sort of protected wellness behavior is definitely relevant. And so I want to recognize that at this point, people might be questioning, this doesn't really seem like a whole lot. Would stretching for 10 minutes a day, for example, really help me? Does that really qualify as self-care, and would it make that much of a difference? And that's a valid question. In brief, I believe the short answer to that is yes. And so I'd like to review at this point just a bit of research that we've done here at Yale, where we investigated the effect of these very small self-care behaviors on physical and mental health. We did this in the context of a somewhat stressful situation. And in these studies, all of our participants were graduate students in a highly competitive degree program at Yale. And just to give you some additional context, an accumulating body of research has found that both the physical and mental health of students worsen follow matriculation in these programs. So this research was designed as a prevention program to compel students to engage in self-care behaviors to try to prevent their physical and declining mental health that is so frequently observed in graduate school. So in these studies, we challenged students to choose small behavioral goals in a variety of domains. And the first was nutrition. Students established goals of their own choosing, and there was quite a range. So for example, some chose to boost water intake, and others wanted to increase their vegetable intake. Others wanted to reduce distracted eating or to stop eating in front of the television or the computer or while they were doing other things. And the key thing was that it had to be specific and measurable. And we encouraged the goals to be very modest, yet meaningful and representing an improvement over baseline. After a few weeks of maintaining those nutrition goals, actually about 3 weeks, students then picked a mental wellness activity. And again, these were individually chosen depending on what people thought would be most helpful to them. And some people chose multiple goals. For example, they might want to do journaling on one day and relaxation or breathing exercises on another day. Some wanted to put on upbeat music and dance around. Others decided that they wanted to listen to their favorite comedians for 10 to 20 minutes a day, really focusing on the fact that laughter is a really powerful stress reduction technique. The point is that they were identifying something specific and scheduling the time to do it. And then finally, a few weeks into that, students focused on physical activity. And if they were already physically active, they set goals to modify their routine. So for example, there were some people who were already active, but wanting to add something like stretching to their routine. Others described their activity level as sedentary. And for them, the goal might be something quite different, like building in 5 to 10 minutes of cardiovascular activity and gradually increasing from there. So again, the key was to pick something very specific and something that would indicate improvement over where they were originally. But importantly, it was something that would not feel overwhelming. So an important part of this process is to pick something that is a new behavior, but also something that is realistic or attainable. So here's what we found. These 2 lines represent scores on a self-report instrument that all of the students completed at the beginning of the semester. And then again, after they had been participating in the self-care behaviors for 12 weeks. We also had them complete the same stress measure again, about 12 weeks after the class ended. And then for comparison, the yellow line is scores from students who were in the same competitive program, but who did not enroll in the self-care class. And what we can see very clearly here is that after engaging in the self-care behaviors, students reported much lower stress. And at follow-up, around 3 months later, they're still reporting lower stress levels than in comparison to the students who did not take the class and who did not engage in the same types of stress management behaviors. We saw very similar declines in anxiety scores. Students engaging in the self-care behaviors reported a significant reduction in anxiety as compared to baseline. And as compared to the control group, this pattern persisted even 12 weeks after the end of the class. And then we also saw improvements in depression. Those engaging in self-care reported lower levels of depression as compared to the control participants. And you can see, of course, that they were basically even at the beginning, improvements in the self-care group, and these mostly persisted into the follow-up phase. So for each of the domains that we evaluated, stress, anxiety, and depression, we saw that engaging in modest self-care behaviors helped to reduce the negative effects of this stressful situation. And we interpret this to mean that the self-care behaviors served as a buffer to prevent the decline in mental health that is typically observed when people are in chronically stressful circumstances. Finally, we also examined aspects of physical or general health, and participants were asked to report how they felt about their physical or general health in comparison to 1 year prior. And they were also asked to globally evaluate their health on a scale ranging from excellent to poor. And here again, we saw differences, with those who engaged in self-care believing that their health had improved compared to 1 year prior, and also feeling that they were in better health as compared to their peers. All of these outcomes data also tracked with qualitative feedback that we received, and that students really experienced those improvements firsthand. So at the end of the semester, students talked about the experience of engaging in self-care and their belief that doing so had really helped them manage their stress. And one way that we think that self-care might help with mental health is through something called self-efficacy. Self-efficacy is really our belief in our ability to accomplish important tasks. And here again, we found that students engaging in these small self-care behaviors reported increased levels of self-efficacy, which we can also interpret to be similar to self-confidence or self-esteem. And this again tracked with the qualitative feedback that we received from students. This quote is actually from a student who engaged in the self-care behaviors for about 5 weeks following the onset of the coronavirus stay-at-home order. And we can see that the student took great pride in their ability to engage in these wellness activities and experienced improvements in self-esteem and mood as a result. So to review, I really want to encourage everyone watching to create a set of self-care strategies. My general recommendations are to start very small and gradual. You might want to select goals in a few domains, and I would recommend building up to that. So for a few days, you might want to focus on mental wellness, reserving a few minutes a day to engage in some sort of restorative or relaxing activity or mood building activity, and then perhaps add on more from there. I'd also recommend choosing things that you think that you would like doing. And if you find that you really don't enjoy something or don't believe that it's a match for you, then I think it's perfectly acceptable to modify your goal midstream. So you could choose something that you would think would be an improvement, but also make it realistic. You want to be able to congratulate yourself at the end of this. And a good way to do that is to actually write things down so that you can survey your accomplishments. So for example, doing a check mark on a calendar, and then you can look back over the past several days or weeks and be like, yeah, you know, I reserved this time to do something good for myself. And it really does help you feel better. Finally, there are additional techniques such as reinforcement and other more specialized strategies to boost behavioral adherence. We don't really have time to get into many of those today, but if you're interested in learning more about those specialized techniques and being led through the process of engaging in a series of health behavior change activities with a community, that is the topic of the course that was recently launched at Coursera. And so I would encourage you to sign up for that. And with that, I think we're ready to take questions, so I can stop the share and try to see the chat.
Awesome, thank you so much.
Oh, thank you.
Yeah, so we did have some questions come in through the Q&A, and I know we also have quite a few questions that we received before the event. So feel free, Dr. White, to take a look at the Q&A. I can also read some of the questions I've been keeping track of. So
Great. Okay. Is there one that or a general theme that's come up so far that you'd like to start with?
Yeah, great question. So I think a recent question that I think kind of ties in nicely with what you just shared is sometimes I create healthy habits that are not long-term sustainable. Since my routine starts to feel monotonous, I start feeling like I'm being a healthy robot. How can I create a healthy mindset and practices that don't limit myself and allow me to think outside the box and be creative?
Mm-hmm. I think that it kind of gets on the theme of wanting to have a variety in a toolkit. And when I say toolkit, I mean a variety of strategies and a variety of things that you enjoy that you can kind of have in your back pocket in the event that something you just don't have the motivation that particular day. So before you all logged in, I was sharing with Laura that following the stay-at-home order, I myself very much practice what I'm preaching here. And I realized that times were going to get extremely stressful and that I should really not even just double down on my activities, but triple or quadruple down, meaning that whereas I had ordinarily been practicing physical activity and nutritional goals and all these kinds of things, I felt that this was time to pull in a lot more mental wellness activities. And so I actually have several of them that I aim to do every day. And certainly my adherence is not perfect. I haven't met it every day, but alternating activities. So for example, I wanted to build in an extra walk with my dog. And I want to mention how pets can be very helpful in times of stress. And so I wanted to build in additional support for walking my dog. But some days I just don't want to, it's too cold or it's rainy. And so in lieu of that, then I've substituted in a different behavior such as stretching or journaling, or even writing a note to a friend or sending a card. Either because sometimes even doing things for other people can be very helpful as well. So I think that trying to add in variety and also sort of self-compassion, if you just need to give yourself a break for a day and try something new, or even just take a vacation from it altogether for a day is perfectly acceptable. I think the overall recommendation would be to employ as much self-compassion, especially during these days, as possible, and to try not to uh, uh, kind of allow that gee, I didn't do it, now I want to give up sort of mentality coming in. It's much more better to be like, you know what, no, I didn't do it today, but I've done it for 4 days out of the past 7, and that is a huge improvement.
That's great. I really cannot hear about self-compassion enough personally. I personally find it easy to have compassion for others, but really it's challenging for me to have compassion for myself. And I think some of the questions that people have asked here are about goals and recommendations for what to do if you don't meet your goals. There's somebody saying, is there a motivation technique we can use to keep on track? Is having a friendly competition to reach goals helpful, or do you find it creates more stress? So I kind of think about self-compassion related to goals a little bit and not meeting goals, but if there's anything else that ties into that kind of goals that you'd like to share.
Yeah, absolutely. I like the talk about self-compassion, and it reminds me of trying to adopt a voice that you might use for a friend. So if, for example, you had a friend who was sharing with you that they were trying to build in some form of self-care activity and they didn't meet their goal for a day or two, how would you speak to that friend? And you would likely encourage that person and say, you know, since when is perfection required? Look at what you've done. You set a goal and you met it. And it was a huge improvement from where you were originally. And so trying to adopt a voice like that the way you would when you're being a good friend, speak to someone, to try to start using that same voice for yourself. And to try to have your internal monologue be the one that you would want to hear from your friends or family members when they are providing support to you.
That's great. So I think another theme that has come up both here live and in at least some of the questions we received in advance is parents needing additional support right now. So we have a question from Joan here. I'm currently doing telehealth as a physical therapist for children. I'm finding that parents need a lot of support during this time for encouraging self-care behaviors. Do you have 1 or 2 suggestions to help me guide parents during this time?
You know, I think that's such an important question, and one that comes up even in the best of times. And I think the analogy that comes to mind most immediately is with respect to air travel. When you're taking a flight and the flight attendants are going through their recommendations, or going through the safety procedures, and they always say, if you're traveling with a small child, be sure to equip yourself with the face mask, with the oxygen mask, before attempting to put it on a child. And the reason that they say that, and that they have to say that, is because very frequently parents' automatic impulse is to attend to the children to the exclusion of their own well-being. That's kind of the sacrificial mindset. But the importance of putting the oxygen mask on the adults first is that if the adults are not able to breathe, then they won't be able to provide the adequate care to the children. And the same goes for self-care and self-compassion and taking care of your own physical health. While it's of course critically important to be there for children and to help them navigate these stressors and the social isolation that's coming along with stay-at-home orders, when parents themselves crumble, they're not able to be very helpful to the children themselves. So I try to like to encourage parents to not use words like, I feel like I'm being selfish, and instead think of it as I'm being self-full. Because in reality, the way that you can be there for children the most is when you're there, emotionally, mentally. And so it is critically important to attend to yourself during this time so that you can help the children.
Great. So there have also been questions kind of related to the theme of really managing difficult emotions during this time. So we're all directly or indirectly being affected right now in different ways by the pandemic. And I have a few questions. I'm going to try to combine a few things here. So kind of generally, how can we regulate and manage emotions during this crisis? And kind of more specifically, I have two people who have shared kind of more specific examples. So one is, how do we maintain self-care when we're living with people who are quite stressed out and maybe unloading discomfort in that home space? And in another example is, unfortunately, really unfortunately, we've seen more racism during the pandemic. So we do have a question here from someone who says, I'm Chinese. Since the pandemic started, all the misinformation on the internet has arisen and created racist acts. You know, some are half jokes, some are memes, some of them are straightforward, and some of my friends are part of this too. I know I should just try to control my reactions and not care about the stupid things that they say, but I do feel sad and hurt, you know, when it comes from someone who's a friend. So, you know, are there things that we can do to manage these like very difficult emotions that are arising for us in different ways right now?
Yeah, I'm so sorry to hear about this experience. Um, it's so not right. And I'm thank you for sharing this. I think it's a very important thing to disclose and to talk about. And it does dovetail with these other emotional experiences that I guess I want to validate you, first of all, that feeling sad or angry in reaction to these sorts of harmful comments is perfectly natural and understandable. In terms of what to do with them and with some of the other experiences, such as sadness and fear, is to try to take on the compassionate voice with yourself. Would you speak to a friend in a manner of saying, you know, I can understand why you'd be upset by that. And depending on the, you know, kind of who's presenting the messaging, if your friend has said something hurtful, I think it might be, depending on the, you know, how the closeness of the relationship, if it is a trusting relationship, if you could, you know, be comfortable saying to the person, I was hurt by that. I don't think that you were trying to be insensitive. I don't think that you were trying to hurt me. But, you know, just to make sure that our relationship stays on a good track, I just felt like I should be honest with you and disclose that I found that hurtful. And potentially you would be doing that person a favor if they didn't realize that what they had said had been insensitive. That might be the wake-up call that somebody needs if they maybe didn't even understand how offensive their comments were, that it might be hurtful to you. When it comes to dealing with family members who are having a difficult time with their own emotional reactions, kind of a similar approach of, I think that most people don't want to spread misery for other people. In fact, the opposite is frequently true. And so to the extent that you can sort of survey your own emotional experience, put a label on it, I am scared, I am sad, I'm grieving the loss of the life that I used to have, I'm worried about my loved ones and my friends, and to recognize those, validate them as being natural reactions to an acute crisis, and also share them and say, you know, I'm pretty afraid right now. Are you experiencing stuff like that? Sometimes when people are irritable or difficult to live with, it's because they are not themselves either facing or processing these negative emotions. And so kind of giving them an invitation to talk with you or to be vulnerable with you might be a helpful way to lead them toward not so desperately trying to push those emotions aside, which is likely what's happening if they're irritable or angry or that kind of thing. They're likely trying desperately to not acknowledge their own anxieties or fears or sadness.
Thank you. I know these are really real and difficult things to talk about, and of course to live. So appreciate you addressing those. Um, we have a lot of questions, and I want to take a moment just to thank you all for submitting your questions. And we won't be able to address all of them, but we will do our best to get as many as we can. So one question we have here is, do you have thoughts on social media and self-care?
I just saw that one. It's a great question. Personal disclosure, I have been limiting my social media considerably, to the point of even deactivating my accounts for several days in a row, and allowing myself only limited access. And when I say allowing myself, it's because I do use social media to stay connected with friends. And it's a very efficient way to do so. But I have found myself kind of getting sucked into not very helpful patterns, either too much social media use or finding myself getting upset over misinformation that's presented there, upsetting comments, and that kind of thing. And so recognizing that it has negatively influenced my own emotional well-being, I've just decided to not engage for a while. And when I say, you know, recognizing what it's doing to my own emotional well-being, I'm logging on to see what my, you know, friends' kids are doing or to see what's happening. And instead, I find myself getting a little bit irritated or angry with a comment that I find to be, you know, misinformation about public health, for example. And like, well, that's not why I logged on. I logged on for a little bit of joy and to feel connected. And instead, I walked away feeling a little frustrated or sad about some news that I saw. Well, in that case, it's not serving its purpose anymore. So I would recommend, if it's useful to you, to continue engaging, but perhaps set specific strategies for pacing or time. Meaning, you know, I'm going to get on social media for 10 minutes at a time, and in the morning and in the afternoon, and check in with some friends and see what they're up to, and then, you know, set an alarm or do something to make sure that it's time limited, and that it can then be serving its purpose of being one of connection rather than something that might be emotionally distressing.
How important is it to maintain a structure to your day? And if so, what's a good way to do this?
It is critically important during this time. And we actually know that it's critically important for children in normal times and for adults. But I think that would be my primary suggestion more than anything else, is to try to establish routines. And these maybe don't have to be perfectly timed throughout the day, but for example, setting a weekly routine where Saturday is going to be, movie night, or Friday is going to be, play games with the family, or get online and play games with friends, or get into some kind of social scheduled event. To the extent that it's possible to regulate sleeping patterns, that would certainly be a strong recommendation, meaning aiming for a consistent bedtime and aiming for a consistent wake time. With people, with those who are still employed, able to work from home, that does build in some structure, but I would also recommend other sorts of scheduling. This is something that in the field we would call behavioral activation, or potentially even pleasurable event scheduling. These are both terms that are used in clinical psychology, but that certainly extend in this situation. And so what that means is behavioral activation. It means going through specific activities that aren't necessary right now, but that would still serve to help create normalcy. So things like going for a drive around the block, or walking the dog around the block, waking up at a specific time, showering, going through what would, these are all accomplishments at this point in time. They're not necessary, but they tend to help people feel better. And then from the pleasurable event scheduling, that's also something that's used in depression treatment quite widely. This is where you would aim to engage in behaviors that make you happy. And that was where I was talking about in the mental health part of the presentation, where students had chosen to do things like listening to comedy for 20 minutes or 30 minutes, or playing with their pets. I've had students in the past who have said that they want to, brush their dog, or, play with their cat for 20 minutes, because they know that it makes them happy. And so protecting that time to do things that you enjoy, to have fun, to just engage in the kinds of things that have historically you found pleasurable, and to try out new things too. Singing karaoke, silly things to make you laugh. Yeah.
That's great. So there are a couple questions related to support specifically connected to people who have been affected by coronavirus. So one is, how do we support healthcare workers during this time? My mother is in her early 60s and is a nurse on the COVID-19 floor in California. I'm spending time with her and supporting her as I can, but she's afraid. And if I can find the other question, I believe it relates to supporting people who have recovered from coronavirus. If there are any things that come to mind to support people who are in that state.
Mm-hmm. For any of these kinds of support, whether it be for coronavirus or being on the front lines, I think that if you know someone specifically that you're concerned about, a really good strategy is to ask them, what can I do to most support you? Can I call you every day? Can I send you a note? Would you like me to find and prepare food for you, or have it delivered? Should I text you? Do you want to hear my voice? Really, if people want to feel supported, and have different needs in terms of what is most helpful for them. So even phrasing it in the, not, is there anything I can do to help, but what can I do to help? Please give me a specific set of things that I can do that would be support, to show my support and love for you. they'll be the best person to tell you.
That's great. I think that really for me, it's such a familiar experience for us, I think, as humans, to feel like we need to know how to help somebody. And it can be hard when we don't know what to do, don't know what to say. But I think we hear again and again, but it just takes practice to actually realize, like, the best thing to do is just ask, and just to, like you said, to just say, what can I do? I'm here for you.
Mhm. Thank you.
So I know we don't have too much time left. I'm
Oh
just,
gosh, wow, that's really fast.
but if you, Dr. White, if you have time, I am happy to stay on. We can continue. There are quite a few questions still in the Q&A, and I'm also taking a look at pre-submitted questions. So if you want to take a look at the Q&A and see if there's anything
Yeah.
that you'd
Um,
like to answer, go ahead.
Sure. I see questions about the friendly competition, whether or not that would be helpful or creating more stress. I think the key here is that it's friendly. And so if it is in fact a friendly competition, or maybe even phrasing it as, hey, let's do a group project. It is definitely the case that social support tends to help people achieve their goals more. It, a great, but it needs to be the right kind of social support. And so if it is something friendly of like, hey, I want to do this, and I think that I would benefit from increased accountability or engaging in this with you or with several friends, meeting, for example, and doing a group meet, stretching or something like that, using Zoom technology. If it's something that is uh, kind and not overly critical if one doesn't show up. I think that would be, I would encourage that. Yeah.
So I'm going to go ahead and ask a question that was submitted in advance. So, under normal circumstances, somebody might be struggling with depression, anxiety, something related. And in the normal circumstance, they may seek counseling from a professional. But we know right now that, of course, most of us are prevented from traveling far. We're not able to go into an office visit. So are there options for people to get counseling?
Absolutely. Teletherapy, I know that a lot of clinicians have moved to allowing or changing their practice to be able to meet with clients remotely, much like this, using a screen share and still being able to get that human contact. This is actually something that I've also been studying for many years, how to get therapy affordably to people who are prevented from accessing healthcare, either by geography or finances. And so we've been studying teletherapy approaches, as well as website housed self-care programs. And those have been found to be quite effective. And so I would highly recommend at this time that people consider teletherapy. And I would also even encourage that people do it before the point of crisis. Again, kind of going back to that public health model where we know that catching a disease or a mental illness or mental or emotional problem earlier, sort of at the first signs of distress, has a much better prognosis, much better outcome. And so I even encourage people to try to view therapy, either counseling or specific therapy, as almost like a spa treatment for the emotions or for the soul. Um, um, Sometimes people are hesitant to seek mental health services due to stigma or fear of the unknown. And I really want to encourage people to, again, take a more compassionate approach of if you had a friend who was suffering either from anxiety or depression, or even just coping with life changes, would you encourage them to seek help if you thought that it would be helpful for them? I think most of us would. And so I would likewise do the same for anyone of, it's very seldom the case that I've ever heard someone saying, you know what, I decided to go in for counseling and gee, was that a mistake? It's always the opposite. And that's also kind of the case with all of these self-care things. It's particularly hard sometimes to motivate ourselves to engage in these behaviors, but universally, I hear people saying, oh gosh, I'm really glad I did that. It ends up being something that it's in it. And we're curious creatures that way, that it's hard for us to kind of motivate and do things that we know are going to be good for us. And sometimes, and usually the course is once we're able to apply certain strategies and build it into our routine, then it becomes intrinsically rewarding. And that's awesome. But it takes a really long time to get there usually. And so from that perspective, you know, trying to remember, you know what, I'm really going to appreciate this after I'm done with it. Every single day, even when it's cold, I want to take my dog for a walk. And I'm like, oh, I don't feel like it today. And then I do it. I'm like, okay, that was awesome. Yeah. So I just want to encourage that.
Do you have time for another question?
Sure.
Yeah, it
Yeah.
kind of relates to what you were just sharing. It sounds like this process is a lot like building a habit. How long should I work at this before it becomes a habit? And do you have evidence from your research around the retention rate of habits like this?
Not yet. I don't actually have that research yet. We are just most recently, the information that I provided for you today was the most recent wave, where we just got this information about 8 weeks ago. So it's fresh. But what I saw there was that the people who had experienced the most benefit after 12 weeks were more likely to continue engaging in those behaviors 12 weeks into the future, even after kind of the class had finished. And so I don't actually have the specifics of how long it takes. So far, the understanding is that it really depends on the behavioral domain. Before you start feeling those intrinsic rewards that then are helpful in consolidating the behavior. I think that's a very individualized phenomenon. And so but it does occur. It just depends on the behavior and the domain and the person as to how long it takes. In my experience so far with this course of people engaging in the self-care behaviors, they have achieved it before the conclusion of the class. So somewhere in the 8 to 12 week zone. But I don't have the specifics, and I should. That's a great question.
Yeah, there's some really great questions here. So someone else has asked if you can give a few examples of self-care ideas that aren't nutrition and exercise. Mm-hmm. And I think you have, as you've talked, shared some examples around playing games, you know, enjoying something that's humorous, something that makes you laugh. And I wanted to add one myself, which I have found helpful, and that's practicing gratitude. So you also mentioned journaling, and I, at various points in my life, have maintained a practice where I write down 3, at some points it's 3, other times it's been 5, like good things that happened to me that day, or things that I'm grateful for. And I mean, sometimes these are so simple. They're very, like, I really have to struggle to find something. But when I do that, it serves as a reminder to me that there are good things. And so I wanted to throw that out. Just kind of practicing gratitude and then writing it down has been helpful. And so I don't know, Dr. White, if there's anything else you'd like to share. I know you have given quite a few examples.
Absolutely. It's and certainly trying to think through of the many varied examples that students have generated for themselves and that I myself have employed and that I recommend. Uh, People have gotten very creative, everything from practicing or learning a musical instrument, playing music, making mixtapes or set lists. I don't know if anybody out there is old enough to remember the good old fashioned mixtape, but creating a set list of music to send to a friend. People have also talked a lot about the power of volunteering or doing small acts of kindness for others. So things like dropping a note or a postcard in the mail, or just sending a text to someone you haven't been in touch with for a long time, just to say, hey, I care. Social support, either giving social support or receiving social support, are both very helpful with respect to self-care. And there's some evidence to show that actually providing social support to others has an even more powerful effect on your own well-being. We are social creatures. And I think that's part of why this time is so challenging for many people. And that it is very unnatural to be in an imposed isolation where you're cut off from your regular life. And so trying to simulate ways or develop ways to still keep those connections and to provide help and support to others is a very, very powerful way to derive personal benefit as well.
It's a great reminder. So I think we will go ahead and wrap up, and just want to thank you so much, Dr. White, for taking the time to meet with us today and share your knowledge.
Thank you so much for inviting me, and thank you everyone for logging in and joining and for your excellent questions. It makes me very hopeful that this is an area of interest. I think it's obviously something I care a great deal about. And so I'm happy that people saw this and said, hey, this seems like something that might be helpful. I genuinely believe in it. And so thank you very much. And I wish you luck.